Hello, everybody, and welcome into Senior Living Live. My name is Melissa. Thank you so much for being a part of our webinar today as we discuss everything Medicare, and I mean everything. We have a wonderful presenter by the name of Bonnie Dobbs, who started her deep dive into Medicare based on a need for someone in her family. Sound familiar? It should to a lot of you out there. That eventually snowballed into her own company, Medicare and Other Red Tape LLC. Now, this webinar is going to be very heavy on Q&A, so please feel free at any time to submit your questions to Bonnie by utilizing the Q&A box down at the bottom of your screen. Just type your questions out there and I will read each of those to Bonnie, and she will spend the next hour answering as many questions as she can. Bonnie, it is so great to see you again today. Thank you so much for being here. Tell us a little bit about yourself and your company, Medicare and Other Red Tape LLC.
Sure, and thank you, Melissa, for having me. Well, I'm a mom, I'm a grandmother, I'm a great-grandmother. I love the beach and good food, and I enjoy eating and complaining that I'm fat. My company is Medicare and Other Red Tape, and I got my license in 2007, and trust me, nobody wakes up one morning and says, I want to become a Medicare agent, right? So in 2008, literally the year after I got my license, a family member developed Alzheimer's, and spending so much time in a nursing home and memory care, I got to see firsthand just how confusing that it was to families. So I've kind of made it my lifelong mission to learn as much as I can about Medicare and explain it in simple terms. Now, Medicare is a bunch of red tape and the fine print that gets everybody. So I try to ferret out all of that and just put it in, simple terms for everybody. I've been in business for 11 years. I personally trained all of my agents. We're all brokers, and there's never a fee for our services. We're in several states, and Georgia is a state that I live in the most. However, I do have a place in Florida, and I go down there as often as I can.
You go down there to get that good food and that sunshine. I hear that.
There you go.
Now, Bonnie, I think people are here for a reason, right? For this webinar, and then on the back end, for those viewers who will watch after the webinar is finished, they're here to talk about Medicare and to find out what it is. If they have specific questions, this is the webinar for that. So let's break it down, starting with the nitty-gritty. What is Medicare? Let's talk about the program itself, who is eligible, and what exactly does it cover?
Sure. So Medicare is health insurance. You get it by paying into FICA taxes whenever during your working years, and you become eligible for Medicare when you're turning 65, or now more than ever, people are working past 65. So as long as your company has 20 employees or more, you can wait about enrolling in Medicare until you want to retire, or if you're on disability under 65, that's another time that you would qualify. Or if you have end-stage renal disease or ALS, you qualify immediately. So those are the 4 times whenever you qualify to join Medicare. Now, the A, B, C, and D's of Medicare, I'm going to kind of blow through that because hopefully this audience has some knowledge on it. So Part A, like I said, you get that by working during your working years, you pay into FICA taxes. And Part A on your Medicare card, if you look at it, it says hospital. Well, it covers hospital, it covers rehab, also known as nursing home, and it covers hospice. So it covers you whenever you're sick and in the bed. Part B says medical. Well, that covers everything outside the hospital, like your doctor visits, your doctor's services, the doctor's supplies. So what do you need your doctor to do? Do you need him to put on a Band-Aid, to stitch you up? Do you need a joint replacement? It covers all of that. Okay. It also covers physical therapy. It covers tests. So whether you need a biopsy or an MRI, it covers doable medical equipment. Things like that would be like walkers, oxygen, wheelchairs. So as you can see, Part B covers a lot of territory. Part C is just another word for a Medicare Advantage plan, which is one of two ways to get coverage to offset the cost of original Medicare. And Part D is one we can all identify with because it stands for drugs. So it's the only one that kind of makes sense out of Part A, B, C, and D. So original Medicare is Part A and Part B. And if you only have Part A and Part B on your Medicare card, okay, that pays 80%. That leaves you owing the Part A deductible, the Part B deductible, and that other 20%. Now, there's two ways to get coverage to offset those costs. One is a Medicare Advantage plan, also known as Part C. The other way is a Medicare supplement plan and a drug plan.
So let's talk about those deductibles because we are still in the beginning of 2022, a new year, which means what? Changes, of course, for these government type programs like Social Security, like Medicare. So some big changes for Medicare this year, and maybe not for the better. So can you break those down for everyone, Bonnie, and give some advice or what you're actually advising your own individuals who are coming to you, your clients, about these particular changes and what they can do to sort of, I guess, even things out a little bit. We talk about the COLA, the cost of living increase for Social Security, which is great, but then it kind of gets wiped out with the rise in the Medicare cost this year.
You're right. We saw the highest raise in COLA in years, or maybe ever. Okay. We also saw the highest rise in Part B this year. So last year, the Part B deductible was $148.50. This year, it rose to $170.10. The main reason, or one of the main reasons for such a high increase, is the new Alzheimer's drug. And I cannot pronounce the name of this drug. I'm not a pharmacist, okay? I think they always put one too many syllables in drug names, but it is the Aduhelm or something like that. That drug is $28,200 per patient should you use it. Well, there's been so much controversy over, would Medicare pay for this? Would Medicare not pay for this? Does it really work? You know, and the verdict is still not out on it. They're not going to release the yes or no on this until April the 11th. Now, on April the 11th, we're going to find out if the feds are actually going to do a reduction in the Part B. So maybe instead of us having to pay $170.10 for the entire year, they will reduce it. You know, the thing about this, I've been doing this for a long time. When I started doing this, the Part B was $94.80. And it went up in increments of about $5 per year. So it was 94, 99, 104, 109, you know, $5 per year on a fixed income. And I'm talking about those on Social Security. Okay, that's one thing. But whenever you start having an increase of this amount from 148.50 to 170.10, it doesn't matter if they have this high increase in the COLA, it just gets eaten away by the increase in Medicare. Another thing that this really is annoying to me is the drug deductibles. Okay, when I started doing this, Part D did not have a deductible, whether you got your drug plan through an Advantage plan or a standalone drug plan. You just paid co-pays. Now it's gone from 0 to this year, it's $480. Most of the time, this only applies to tiers 3, 4, and 5. But that's just like, that is an enormous, enormous amount of money for people who are on medications. And because medications are all categorized into tiers, and all companies, have their own way of doing this, there's no way that doesn't really eat into your monthly budget whenever you're a senior. So when I started, like I said, first it was 0 deductible, then there was like $75 and $100. But last year it was $445. This year it's $480. So those are major increases, for both the Part B and the Part D.
Yeah, it's like our seniors can't get a break. I mean, we're talking about inflation across the board. So it's like, do they pay for food? Do they pay for gas if they're still driving? Do they pay for their prescription drugs? I mean, it's starting to get a little crazy. So let's hope that in April they roll back the cost and can at least help our seniors on that end. So we'll keep our fingers crossed there. But Bonnie, of course, you're here to sort of cut through the minutia for everybody. We've got a few questions already, and I think so far a good start to this webinar. I think this is a really good time for those of you who want your questions answered to get in there, start typing that question out. As many as you need to understand what your benefits are, what you're going to get out of them, this is the time to do that. So before we open it up for Q&A, let's get to one more question here, Bonnie, and that is misconceptions. I think a lot of people have some misconceptions about Medicare. What are the biggest misconceptions that you see when your clients walk in the door?
They think that Medicare is free, that they don't have to pay for it. That is not true. They know that during their working years, or some people know during their working years, that they have to pay for FICA taxes. So they think whenever they turn 65, or if they retire after 65, they think everything's paid for. That is not true. You're only paying for your Part A premium. You're still going to have that Part A deductible. You've never paid for the Part B premium. And that's what I was talking about. This year, it's $170.10 a month. That's a lot of money. The Part B has a deductible, so thinking that Medicare is free and then realizing that you have these charges, that's a rude awakening, especially to somebody who is just dependent, on their Social Security. The other thing is, they think their plan is good anywhere. That's not true. Their plan is good in their service area if they're on a Medicare Advantage plan or a drug plan. Now, if they're on a Medicare supplement plan, those plans are good anywhere in the United States that they live. But if you're on an Advantage plan in a drug plan or a drug plan, those are service area specific. So if you move, you need to have your plan reviewed. And this is one of the ways that people end up getting a penalty, is because they do have that misconception that their plan is good anywhere. And so they may move across the street, but they're in another county. Now, I know this blows everybody's mind because Medicare is a federal program. They think it's good anywhere. Well, that's wrong. All of these plans differ state to state and county to county. So that literally means if you move across the street and you're in a different county, you may be out of your service area, or you will be out of your service area. You need to have your plan reviewed, because if you're on an HMO, you would have to pay the entire bill. Okay. If you're on a PPO, it's going to cost you more. but you're going to subject yourself to penalties if you're on a plan and you're out of your service area for more than 60 days. Okay, actually it's 63 days, but that's really, I just like to say 2 months for the most part. Okay. Yeah, so those are the two of the biggest things. Them thinking that Medicare is free and they think that it's good anywhere.
That was the biggest shocker to me when we discussed that. I did not know that. And I mean, that is something that, I mean, when you have Medicare, you have to watch your plan like a hawk, or have somebody like yourself or your other brokers in your corner so that you make sure you're not getting penalized, or that you're
Right.
not spending more money when you don't need to on these plans. So I'm so glad that you pointed that out, Bonnie. Let's get to our first question. And again, you guys can remain anonymous. And this is a question from Anonymous. My main question centers around utilizing Medicare for 24/7 in-home caregiving services, companion support, in-home support, doctor visits, etc. Can you explain how Medicare can support this for my elderly parent? Also, my elderly parent has a secondary retirement medical benefits from her employer. Is this the Medicare C that you made reference to? Will it also help with getting in-home caregiving services?
Okay, those are two major questions.
Yeah.
So let's do one at a time. Okay, so read the first question again, and then once I answer it, let me go to the second one because it's going to be an involved answer. Okay.
Excellent. So the first question, can you explain how Medicare can support this for my elderly parent and supporting in-home caregiving services?
Okay. Medicare does not offer companion service or sitting service.
Anything with doctor's visits?
There are, depending on where they live, and I'm assuming they're in Georgia, they don't necessarily have to be, but in the Atlanta area, there are several different doctor groups that now do house calls. So if you can contact my office after this, if you're not in the Atlanta area, if you're in the Atlanta area, I have some referrals for you. If you're outside the Atlanta area, I do have agents in other states. So hopefully we could help you there. Or you can always call the 800 number on the back of your insurance card and ask them if they have providers that offer in-home or house calls. That is called house calls.
Okay, so the doctor visits would be house calls. Now,
Yes.
what about in-home support, 24/7 in-home support? Is that not covered by Medicare?
That is not covered by Medicare. Now, if your loved one is VA or TRICARE or CHAMP VA, or the spouse of someone who's VA, CHAMP VA, or TRICARE, then they do offer benefits. So, but you would have to call either the Veterans Administration or TRICARE or CHAMP VA direct on those. But the program Medicare does not cover any in-home care as far as sitting service or companion service.
Okay, and before we get to the next question, you mentioned the VA. We've got a couple of webinars on aid in attendance who helps with VA benefits. So if anybody here is wanting information on that, you can go to www.seniorlivinglive.com. You can type in VA benefits. We have several webinars with Emily Schwartz, who is the president of Aid in Attendance. Okay, so your second question is my elderly parent has a secondary retirement medical benefits from her employer. Is this the Medicare C that you made reference to?
The Medicare C that I made reference to was mostly whenever someone has an individual plan. Whenever you're on a plan through a retiree plan through an employer, they can either have an Advantage plan, which would be a Part C, or they may have a supplement plan. What you can do is you can look on the card, and if it says HMO or if it says PPO, okay, those are Medicare Advantage plans. If it has a letter like F is in Frank, N like in Nancy, G like in good, then those are supplement plans. If you can't find that information, call the 800 number on the back of the card, or you can call someone at the HR department and benefits where your parent retired from, and ask them if this is an Advantage plan or a supplement plan.
And then the final part of that, will the Medicare C or her employer benefit, not Medicare C, excuse me, will that help with getting in-home caregiving services?
No, that's the only time you can get any in-home care is through the VA, TRICARE, or CHAMP VA with those benefits.
And you mentioned a couple of times on utilizing the 1-800 number on the back of the card. What is the wait time right now for somebody calling in on that particular number to speak to somebody? Do you know?
It differs. It differs during the time. I mean, because of the time of day that you call, because sometimes they're busier than others, but it's calling Social Security or Medicare that you sit on the phone, for 30 minutes, an hour, hour and a half, or whatever. But whenever you're calling the 800 number on the back of your insurance card, and that's what I'm referring to here. I'm not talking about calling the number I'm not talking about calling the 800 number on your Medicare card. Okay. So for your benefits, call the 800 number on your insurance card.
Perfect. Great job, Bonnie. Okay, and we got a thank you from Anonymous for answering those questions. Great job, Bonnie. All right, so from Robert, is Part A and D monthly or yearly costs?
Part A is, well, you pay for, I'm not sure if he's talking about the monthly premium or the annual deductible, okay? Because Part A has a monthly, Part A, you do not have a monthly premium because you pay for that via FICA taxes during your working years. Now, Part B deductible this year is $1,556, okay? So that answers Part A. For Part D, if you have a supplement plan, then you'll have a standalone drug plan, because supplement plans do not have the drug plan built right in. Okay, so those plans differ in price from like $6 and something up to over $100. It depends on your medications and on your service area. So every year on your drug plan, you can put all of your drugs in and find out which company has the lowest monthly premium for your Part D, the least out-of-pocket costs, which would also include your deductible. Don't forget those deductibles, because just because the federal government allows a company to charge up to $480 doesn't mean they all do. So usually the higher monthly premium that you have on a Part D plan, the lower your deductible would be. Deductibles are annually, monthly premiums are monthly. Okay. Now, if you choose a Medicare Advantage plan, the drug plan is built right in. So you're not going to have a monthly premium on the deductible. Excuse me, what am I saying? You're not going to have a monthly premium on the Part D, okay? And you may or may not have an annual deductible on the Part D. So the two ways to get Part D is through an Advantage plan, where it's just built right in. You don't have a monthly premium, and you may or may not have a deductible. Or if you get a standalone drug plan, you will have a monthly premium, and the deductible will vary from plan to plan.
It's like alphabet soup, right?
It's never ending. So yes.
Yeah. All right. And I guess you had answered that earlier for Robert in your conversation prior to asking that question, but just wanted to throw that out there. It is a good question in case somebody else was curious about the A&D costs.
Sure.
So moving to Daria, she asks, my mother is in senior living in a complex for Alzheimer's. We were told that Medicare covers only one piece of equipment per year or per 2 years. Is that correct? And then the follow-up here, it's not a question. She just says, this year she is in need of a hospital bed and a Jared chair. Thank you.
With large items like that, that is correct. If she needed something like a walker or a rollator or oxygen, those are different things. But big things like wheelchairs, the electric wheelchairs or the hospital beds, yes, those are limited.
So are those limited per year or per 2 years?
I think it's per year on that. She can check with her plan, because the plans, any plan that you ever have has to be Medicare equivalent or better. Okay, so the other thing you can do is go to every year there's a book that's released from the CMS, and it's called Medicare and You, and this year it's Medicare and You 2022. Last year it was Medicare and You 2021. Okay, so you can go to medicare.gov if you don't have a hard copy of it, and you can download a copy of it, and you can go through there just to check to make sure that your insurance company is, but that sounds about right on the higher expensive items like that. I think it's one per year.
Okay, and Daria says, thank you. So just as a follow-up there, the hospital bed, I could see that as a big ticket item, and the Jerry chair as well?
I don't know exactly what a Jerry chair is or what the cost would be.
Okay.
Another thing that's expensive are bed lifts, and it's really difficult to get a bed lift, like if you have a loved one in a home. I mean, staying at home, not in a community. So,
Gotcha. Okay, this is a great time, guys, to put your questions into the chat box, or you can put it into the Q&A box for Bonnie. As you can see, she's rapid fire, happy to answer those questions. And Daria says, Jared chair is a wheelchair that reclines. So I would think that would be a bigger ticket item. Yes.
those are extremely expensive. Yes,
Okay.
yes, those are extremely expensive. For the people who are on here, there's 2 documents that I think would be very important, or it is very important that everybody know about. One is called the evidence of coverage. Now, the evidence of coverage is a little booklet that you get with your welcome packet each year whenever you get your new card, okay, or whenever you first enroll, you'll get one also. But in the evidence of coverage, it has got every single benefit and things broken down, okay, that your plan offers. And a lot of these questions, instead of staying on the phone, call the 800 number, like you said, and waiting for 10 or 15 minutes or maybe 20 minutes for somebody to answer the phone, you can just look at the evidence of coverage. If you don't have a hard copy, you can also just go online and read it. All you have to do is just look on your insurance card, and then go to, it'll have the website on there. Register your account with your member ID number, and then you can go in there and pull up anything about the evidence of coverage if you have any questions about what your plan covers. So that's very important that everybody know, because you can just see it in black and white yourself, okay? And then if you have questions, then you may want to call the 800 number if you need clarification on anything. The other is we call it ANOC, and that stands for Annual Notice of Coverage. So every year during the month of September, you'll either get an email or in snail mail, okay, an actual copy of the annual notice of coverage. Now, what this document is they go line item by line item with every benefit for the current year and what that cost is going to be for the following year. So you can look to see if you're going to have a $5 increase in your copay to go to your doctor, or you can see if, maybe they're going to increase your dental. You're going to have $1,000 dental instead of $500 dental. The annual notice of coverage is one of the single most important documents that you get, because you can look, and it's so simple and easy, because it starts with the monthly premium and then the deductible, if there is a deductible, and then it goes down. So, should I call and have my plan reviewed, or should I just stay where I am? Because if things are going up a reasonable amount, okay, that's one thing. But like if your drug plan is going from a $28 monthly premium to a $60 monthly premium, get on the phone. The other thing is, don't wait till the last minute. Okay, annual enrollment every year is from October the 15th until December the 7th. So call in the beginning of annual enrollment. Be one of the first, because you want somebody who knows what they're talking about to help you through this. Whereas if you wait till like Thanksgiving and go, well, I really need to call about that. I mean, there's 60 million Medicare recipients. That's a lot of people. So if you think you can wait till the last minute, I know we run out of time every year that last week. I just don't have enough agents, that can handle all of the services, to review everybody's plan. And of course, that is our goal. We always want to review everybody's plan to make sure they're getting the most benefits for the least out of pocket. But those two, the evidence of coverage and the annual notice of coverage, are two documents that every Medicare recipient should be aware of and utilize. That can save you tons of time over the phone, and also with just being able to find out what is coming down the pike for you for next year. Now, I know one thing that's been a positive thing since COVID, and that's telehealth appointments, because they were almost unheard of before. And then, once COVID was in full bloom, nobody wanted to go to a doctor's office. The medical workers didn't want you to come to their office, so telehealth became a really big part of Medicare, especially Medicare recipients. Okay. And one thing that they are continuing to do, and I think this is wonderful, is people who have mental issues, who have behavioral issues, who have substance abuse issues, they are continuing to allow those people to have telehealth conversations or appointments, with their therapist or their doctor. That is so important, because many people, they maybe didn't have mental or emotional issues before COVID, but whenever the whole country was on lockdown and nobody could socialize, or you couldn't do anything, it's like everybody's world just stopped. So I think that the telehealth visits are wonderful. I use it every time I possibly can, and I encourage everybody to use telehealth whenever they can. Now, there's sometimes, of course, whenever you're going to have to go to your doctor, but for those who are getting mental or behavioral health therapies, then this is a blessing. It's just really a blessing.
Yeah, and you know, the pandemic was hard for everybody, but our seniors especially. And so, as you mentioned, it's just wonderful that is an option now, and so easily accessible for so many people.
Right.
Let's get to Lauren's question. And she says, I retired from the reserves and have TRICARE for life. So far, the Medicare and TRICARE for life combination have worked well to limit my out-of-pocket expenses. Is there anything I need to watch out for in the future?
The wonderful thing about TRICARE, and thank you for your service, okay, is TRICARE pays for everything. So if you're on TRICARE, it's like putting that part of your life on automatic pilot. You don't ever have to worry about anything. If you have a question, call TRICARE. Do not ever call an agent like me, okay? Agents like me cannot help you. There are unscrupulous agents out there who will try to put you on an individual plan. You do not want to do that. With TRICARE, you do not have copays. You don't have any out-of-pocket cost. If you are ever put on an individual plans, all individual plans have copays, some monthly premiums, okay? So stay where you are. Thank you for your service, and you're good to go.
Yeah, so in the future, I mean, that seems like it's something that has stayed the course, right? And you don't foresee any changes in the future for someone like Lauren.
TRICARE and Champ VA are the two that they don't want to talk to an individual agent, because if if individual agent puts them on a plan, they're going to have copays. I think Champ VA folks only have like $300 a year. You know, if you get put on an individual plan, you could have more than that per month. So once again, thank you for your service, and stay where you are.
Yeah, and you talked about the unscrupulous type people, some of the scammers. We're going to get to that in a little bit, because they're out there, and we want to
Yes.
make sure that you don't get duped. So hang on for that. Film at 11. All right, we have a question here from Debbie. My mother is receiving hospice service, which is covered as a bundle by Medicare. We have learned this covers all equipment she needs, as well as a hospice nurse weekly, an aide daily, Monday through Friday, a social worker checking in, and chaplain services as needed. But we also learned that PT and OT now no longer are covered, and that drugs had to be on the hospice formulary to be covered. Any other highlights to be aware of in terms of Medicare coverage in a hospice scenario?
The one thing is hospice pays for the medication that you were diagnosed with. So oftentimes when people are on hospice, they may have 2 or 3 different things. Like somebody may have heart problems and COPD, or COPD and cancer. So if you are diagnosed with cancer, they're not going to pay for your COPD. They'll pay for everything that has to do with the cancer. Okay. That is true. So that's about the only thing that I possibly can think of. One thing that I would really like to stress is, in the past, people thought if someone was put on hospice, that was it. It was just a matter of time, and that window was very small. I talked to one of my agents yesterday. She said, my client's been on hospice for a year. She's not getting any worse. So guess what? They're taking her off hospice. So just know, just because you've been put on hospice, that doesn't mean anything. That's where your medical condition is today. And people, I mean, I know people who've lived 3 years after being put on hospice. So don't think that that's as terminal as it sounds, okay? Because oftentimes when people come out of the hospital or out of rehab, and they go on hospice, they'll call me and they'll be so upset, and I'll go, no, that is the best thing possible, because they are getting additional care that you can't provide. And hospice is no longer a place. Okay. So hospice oftentimes now is in your home or in their home, wherever they call home. So they don't necessarily go to a place like a hospital type setting. There's a few of them, but that is not the rule now. So, but that, I hope that answers your question.
Yeah, and actually, I can actually speak to that too. My grandmother had Alzheimer's and was placed into hospice, and was there 9 months before she passed away. As you said, it could go a couple of years. So Debbie did add, we understand there is a recertification process for hospice for continued Medicare coverage.
Then her doctor or hospice, it's probably the social worker with hospice, will help walk them through that, because they know if the patient is, just holding their own, or if they are doing, if their health is improving or whatever. So the social worker with hospice will help. And hospice is just wonderful. I can't say enough wonderful things about them. When somebody calls me and they say, oh no, we don't want to start our loved one on hospice, it's like, oh yes, you do. That is awesome. There's a lot of people I think need hospice that don't get it. So if your loved one is on hospice, that is a good thing.
Yeah, and I agree with that 100%. And I think more people need to hear that, right? More people
Sure.
need to hear that, because you hear hospice and, as you said, you think it's terminal or it's the end, and that is just not always the case. So Debbie, thank you. She said very helpful. So thank you. To Dennis now. Wife and I both now have an Aetna Medicare PPO plan. It has a $1,000 per year for dental. Is there any way we can add coverage for additional dental care, something like a supplement plan, or what? Thanks. And Dennis, I hear you. It's like we treat teeth like it's something completely separate from the body. It's ridiculous. So what do you tell your clients, Bonnie?
There are dental plans. He can call whoever enrolled him in his plan and ask if they have standalone dental plans. He can do his own research. He can go on the internet and research dental plans in his area. So there's different ways that you can get dental plans. Most dental plans, you usually have to pay into the plan 1 year before you get the big things, though. Like not root canals. That's not like crowns. Okay, some offer dentures. Most recently, some of them have started offering implants, but just know, you can't have a plan and pay like $50 a month for 2 or 3 months and go get a $5,000 dental implant. That does not exist because the insurance company has to, have some money from you to help pay for the plan. So most of those plans, the major dental work, you have to have that plan at least for a year.
And I don't know, Dennis, if this is right or not, but that additional plan that's a part of his PPO plan for dental, and this is the same with my insurance, is that it covers some dental, right? Like a yearly cleaning and maybe some x-rays, as long as they're not bite wings, but it doesn't cover everything. And so you're paying $1,000 a year for something that doesn't give you a lot of coverage, which may be why he's asking for the additional coverage. What do you tell people in that scenario, where they just need more than what their basic plan is offering them?
Well, luckily for him, okay, he has a plan that is giving him $1,000 of dental, and it's a reimbursement on his particular plan. It's a reimbursement, which gives him the flexibility to go to his dentist, okay, or to go to any dentist. You don't have to go to a dentist that's in the network, okay. He'll just go to the dentist, get the bill, and then send it to the company for reimbursement. Okay, so, and then if you're going to double up with dental plans, Make sure that you ask your dentist if they, can you double dip? Okay, that would be really important before you go pay for it. The thing about dental, vision, and hearing plans is, okay, y'all listen really good. Your employer always has the best, okay? The best dental, vision, hearing plans are always offered through an employer. Once you're out on your own, individual plans aren't that good. An example, you'll pay, I don't know, you may pay $500 or $600 per year, and your plan is only going to pay $1,000. So you've paid, if you pay $600, that means you're going to get an additional $400 in benefits. So, make sure that you read and find out what your monthly premium is, because there's usually $100 deductible, and then what your the amount of the policy payout is.
And he added, it just reimburses us for whatever dental services up to $1,000 each.
Yeah, I thought that's what I said. If I didn't say that, shame on me. That's exactly what I meant to say.
No, I think you did, but that was just a follow-up to let you know sort of a little bit more about his plan. But when we talk about this, it makes my brain hurt. So it's just, and so you can imagine what it's like for somebody who desperately needs the care and is really just trying to understand what they're being given, what they have, where their money's going. So this is why people like you and your brokers are so important, offering that service for free for people to understand what kind of care they can get. And Dennis actually says thank you. So ladies and gentlemen, to our viewers, we've got a little less than 15 minutes until the top of the hour and we wind down this webinar. So please feel free to get in any questions you have remaining for Bonnie. And Bonnie, we promised we would get to this. So we talk about scams, right? And there are a lot of people out there, whether it's Social Security, any sort of government programs like Medicare. So how do people avoid scams and weed through all of those entities who may or may not have somebody's best interest in mind?
Yeah, so everybody remember the IRS, Social Security, Medicare, Medicaid, any government entity, they're never going to call you over the phone. They're always going to email you. So if somebody calls you on the phone and say, oh, you didn't pay your IRS bill, we'll take your credit card now. Scam. That's a scam. Anybody that calls you. Okay. Now, if they send you a letter or an email, you have to look really, really closely at that. And if something doesn't seem just right, have another person look at it, and always look for something on there that says, in little fine print, we are not affiliated with the US government. Because if Medicare is calling you saying they're Medicare, they're with the US government, right? Okay, so that's a clue. Or look for things that have the name of companies. And a lot of these companies get really creative and they want to sound like the government, like USA Medicare, so that sounds like Medicare, but that's not, okay? So whenever you get a call, just totally disregard it. Totally disregard it. If you get a letter or an email, read it very, very carefully. Now, on social media, you'll be, I don't know, looking at Facebook or just, I don't know, looking at the news, Google News or something, and something will pop up. Don't click on that stuff. That is clickbait. Because if it comes up and says, you could be getting $170.10 back on your Medicare, okay, that's clickbait. You don't want to do it. You're going to end up with somebody just trying to change your plan. Doesn't matter what plan you're on. You may be on the best plan for you. They're just going to change it because they want to get paid for it. Okay. There's shysters out there. Another thing is social media will hijack your friend. Okay. So your friend's email gets hacked or their Facebook gets hacked. And then you'll get a message from somebody who's impersonating your friend. And they'll say, hey, this is Sally, and I want to introduce you to a government program. Like, you can get a grant to pay for your drugs, or you can get a grant to pay for your mortgage, scam. There's a lot of romantic rackets out there. There's a lot of cryptocurrency. All of these people, they're just imposters. So stay away. Don't click stuff. Don't fall victim to clickbait. And then if you get a message from a friend and she's talking about government free programs, or this dating site's guaranteed to put a smile on your face, or something like that. Something that would sound totally out of character, or even if it does sound like something they would say, call your friend on the phone and say, hey, did you send this to me? Because that's the way, that's one of the first ways people get their identity. And if anybody ever calls you on the phone and they want to know your birthday, your social security number, your Medicare number, your address, just don't do it. Just don't do it.
And another one is just emails, right? Straight up emails that actually look legitimate. They're being sent to you. They sound legitimate. We get those from Amazon, from PayPal. But are emails common scams as well for Medicare?
Absolutely. Every day. Or another thing is they will purposely target seniors. And it could say, Amazon gift card, $50. And then you click on it a couple of times. Well, they want you to send them $25 and they'll send you $50. Whoa, no. And anytime somebody wants you to pay them in gift cards, that is a scam right up front.
Yeah, no, I think you cover the gamut there. And there are so many people trying to scheme and scam innocent individuals, but specifically targeting our seniors. So please be careful out there. Now, Bonnie, as we wind down this webinar, which has been very informative, if somebody wants to reach out to you in maybe the Georgia area, somebody who may not be in the Georgia area, how can they contact your company for help?
Sure. You can go to Medicare and otherredtape.com. Sometimes people don't like to type out that. So you can just go to BonnieDobbs.com. That's BonnieDobbs.com. Our telephone number is 770-373-7541. And we're here Monday through Friday. If you call and we don't answer, that means that all of our phones are overloaded and we're helping other people. But as soon as we possibly can, we'll get in touch with you. And speaking of that, I think another thing with seniors is staying connected. Because so many seniors they end up alone and they're lonely. So, stay connected with your family and friends, exercise, get involved, stay socially connected. This is your time. You worked hard, you got there. So, so enjoy it. And I think insurance plans should come with beach therapy. What do you think?
Beach therapy and good food. Remember,
there you go. Beach therapy and good food.
I love it. Bonnie, we do have one more question that came in here in the home stretch. It's from Anonymous. Speaking of scams, the hearing aid industry seems like the Wild West. How does one start finding legitimate services in this industry? And I never even knew that was the case. What are you hearing?
Okay, so the easiest way to not get involved in that is don't pick up the phone and start calling or Googling, okay? Call the 800 number on the back of your insurance card. Find out which companies they are contracted with. That way, they're legitimate, okay? Because your insurance company is contracted with them. At that point, once you find out the companies, then of course you can Google them and find out the reviews and so forth. But always, whether it's dental, vision, or hearing, or any physical therapy, to go get a test at the imaging center, always find out who is in the network with the company that you have your insurance plan with. That way you can avoid being taken advantage of by scammers.
Yeah, and the worst is when you just kind of freestyle and you pick up the phone, you call somebody that looks like they have great reviews, and you say, are you in network? Can I use you? Will my insurance be covered here? And they say, oh yeah. You get there and you get the bill, and then you find out, well, it wasn't quite covered the way you thought or the way you were told. So that is a great response to that. Just call and make sure they're in network. Use that card, and obviously use the card on numerous occasions when you're dealing with your insurance. Bonnie, we are winding down here. This webinar has been so informative. Robert chimed in. Thanks, lots of great information. Finally, this is a service that you provide that is for free, correct?
Correct.
So people can call you, they can call your brokers, as you mentioned, Monday through Friday, and get the help that they need, and it doesn't cost them a dime. So please be mindful of that to all of our viewers who are watching. Another one coming in from Lauren. Thanks, Bonnie. Very helpful. Bonnie, you're a gem. Before we head out, we've got about 3 minutes till the top of the hour. Any parting words you have for our viewers as it relates to Medicare?
I would just like to tell them how we provide our service for free. So as brokers, we're contracted with all of the carriers, so we can compare and review their plan against any other plan that's on the market. And all of the providers pay us a standardized commission. So we're contracted with all of them, but I'm not employed and have no obligation to any of them. So that way, since they pay a standardized commission, we have no incentive to put somebody on this plan versus this plan versus this plan. Our whole goal is to put everybody on the plan that serves their needs best. Now, with all this Medicare talk that we've done today, I would like, in leaving, for everybody to remember that sunshine is the best medicine, and it doesn't come with a $35 copay.
Thank goodness for that. I love it. It actually might on those days that are nice and cloudy, but today, at least in Georgia, we got that free and clear. So Bonnie, the thanks continue to come in. Dennis says, great webinar. Thank you so much. Debbie says, truly appreciate the information from Bonnie, but also to Arbor for hosting. And we are here for you guys to help provide these informative webinars with professionals around the country to help arm you with all the information you need to sift through senior living and save some money in the process. That's what we're here for. Bonnie, final question, and this is from Anonymous. They want to know the telephone number again to reach you or some of your brokers with Medicare and other red tape. Sure.
It's 770-373-7541.
All right, and Daria, swooping in, so helpful. Thank you for cutting through the maze of Medicare. And that is what Bonnie is all about. She's dedicated her life to this. Bonnie, you are a gem. I've said it before, and I believe it is true. You're so helpful in helping so many people, and you have certainly helped our viewers today. Thank you so much.
You're welcome. Thank you for having me. Thank you, Arbor. Thank you, Melissa.
You got it. And we'd like to have you back at some point down the future, down the pike. So for those of you watching, each and every one of you will receive an email tomorrow in your inbox giving you the link to this particular webinar. You can watch it again. You can send it to family and friends. Or if you're interested in finding out a little bit more about VA benefits, more about Medicare, head on over to our website. It's www.seniorlivinglive.com. Our videos are available 24 hours a day, 7 days a week. As always, everybody, thank you so much for being a part of Senior Living Live. Have a great day.